Hello, everyone, and welcome to the Global Financing Facility Investors Group Meeting Debrief. My name is Liz Colway, and I'm speaking to you on behalf of Global Health Council. And I just wanted to thank PMNCH for helping to co-host this webinar. We'll get started in just a minute. I know there are a few folks that are still coming into the webinar room. So thank you for your patience, and we'll be back in just a minute. Welcome again to those who just joined us. I just want to go over a few logistics before we get started. If you do have any questions, please feel free to use the chat box on your GoToWebinar panel. That's the best way to ask a question during the presentation and then when we're taking questions at the end. We also ask if you could please identify yourself with your name and organization as well, and then also to whom you want to direct your question to. And with that, I want to hand it over to Kadi Toure to begin the presentation.
Thanks, Liz. Can you hear me?
Yes, we can.
Perfect. Hi, all. My name is Kadi Toure. I'm with the Partnership for Maternal, Newborn, and Child Health. We host with the Global Health Council regular webinars on the Global Financing Facility in support of Mesfin and Joanne, who are the current civil society investors group representatives, and we generally do this before and after the investors group meetings. So we had a call or webinar a few weeks ago where there was a presentation of what was going to be discussed at the IG meeting that happened a couple of weeks ago now. It's been a busy month of October, November. The agenda for the call today is going to do a couple of things. One, Mesfin is going to provide us with an overview of the discussions that happened at a civil society meeting that was held ahead of the investors group meeting for the GFF. Joanne will talk us through what the discussions at the investors group were, so that would include the inputs from the civil society meeting and how those were received, but also more broadly all of the different issues that were raised during the IG meeting. One of the things that also happened throughout the month of October, we put out a call for nominations for the new representatives, civil society representatives to the investors group, and received a number of applications. There was a process of shortlisting, and we now have new civil society investors group representatives that are also on this call that will be saying a word. The reps are Angela Mutunga, who works with Advanced Family Planning, is supported by JAPIGO, and Aminu Magashigarba, who works with the Africa Health Budget Network. There are also two alternate representatives, John Townsend from Pop Council and Chris Armstrong from Plan Canada. So those of them that are on the call will be making some statements later on. So without further ado, I'm just going to turn over to Mesfin first, and then Joanne for updates from Tanzania.
Hello everyone. Yeah, thanks Kadi for the introduction, and I'm speaking on the it's called a readout from the civil society meeting, which was held on the 1st November, just before the opening of the IG meeting in Dar es Salaam. Just to give you a little bit of background, this meeting was held just to take advantage of two opportunities. One was the FP 2020 reference group, which is also meeting in the same area, bringing together civil society, working on family planning and youth group, and as well as the investors group for GFF. And we had a lot of opportunities for joint meeting. I think we didn't want to miss these opportunities for influence as well as sharing experience between GFF and FEP 2020. So with that background, and we had a meeting on 1st November, and I will give you a quick update in terms of the outcome of that meeting and how it went. Next slide, please. Again, next slide. Just going to this meeting, I think the key message for us was just carrying the message of civil society, our desire and, wanting to be engaged in the GFF, not just only for the process, but it's an active constituent in the countries, basically to help deliver increased impact, both funding as well as addressing the equity issues for RMNCAH and nutrition. So it wasn't just only asking for, okay, we need to be involved and demonstrating the value of GFF, civil society in GFF. I think we have come a long way in terms of recognizing the role of civil society, but demonstrating the impact and the result that GFF could achieve by meaningfully engaging civil society. Next slide. So in this meeting, we had a representative, civil society representative from 8 GFF countries. Many of them are those who have been in the front run, including from Tanzania, as well as Senegal and the DRC. I think there has been quite a lot of rich experience of engaging in the country platform, and we had also participants from the region, from the Africa region, and as well as partners who have been supporting civil society engagement from global. Most of them are actually members of the civil society coordinating group. And we had also participants from the secretariat, GFF secretariat, including Monique, the GFF practice manager, as well as other members of her team, and as well as from Government of Canada, which I'll talk later on in terms of the point they shared with us, and other partners from WHO and multilaterals. And again, as I said before, the focus on practical solution to ensure civil societies can actually contribute to success of GFF. I think we worked on how do you make it work rather than whether civil society is important or not. I think that was basically the focus of the meeting. Next slide. So again, just to give you the objective of this meeting, as I said, it is basically to share and document lessons from the implementation of GFF at the country level. So so far, what has been the case in terms of engagement as it relates to civil society, and identifying what worked well or could be better, and why it worked, why it didn't work in some countries. So basically we had a rich discussion, listening from the 8 civil society participants who came from the countries and sharing their own experience in terms of what worked and what didn't work, and then the reason behind that. And prior going to this meeting, I think we had a civil society coordinating group have been working on what we call it a civil society engagement strategy. This is something that we think it is important to articulate our engagement strategy, similar to what private sector actually develop in terms of their engagement strategy with GFF. So in this meeting, to review and discuss that draft and outline, next steps and role and responsibilities, and as well as the cost implication of the strategy, so which includes what would look like the engagement at the country level in terms of supporting civil society engagement, and at the regional level, which is also supporting in the global level. So that engagement strategy was presented and we had a discussion on that, and as well as to discuss and agree upon system and approach for further enhancing communication and information sharing from global to regional and national level and vice versa. So this was the objective of our meeting. I think we have covered each objective in detail, and we believe that we have a key action items to take this recommendation forward. Next slide. I think in this meeting there are quite a number of challenges that was outlined by the participants, and I think these are important to recognize, and which is also the basis for the engagement strategy. And I think part of the issue is related to transparency. Many of the participants from the countries, they had very limited information or even lack of clarity. Who is the GFF rep? How is selected, and whom they are representing, and what is the feedback mechanism between the constituency and the representative. So that has not been very clear, and in many cases. So I think the issue is that in many cases civil societies rep hard to get information from informal contact, or either from people outside the country who is supporting them in some way. And I think it has been ad hoc, not necessarily systematic. And I think the issue of transparent, meaningful engagement through transparent communication has always been the challenge. I think that came out, and it wasn't a surprise, but I think it was good to hear from the countries. And again, around communication, it always come at last minute. You have a partners meeting that may be happening outside the country, then civil society has to organize themselves, and this all has a resource implication, and I think the lack of advance notice has been a challenge, I think, for many of them. Again, some of the challenges, related to fully operationalizing the GFF principles of inclusiveness and participation. I think there need to be a clear process in terms of to ensure actually these principles are implemented. And I think the example that was shared from Cameroon as well as Senegal, you can see on the slide that there has been good engagement when you have someone who is designated as a focal person. I think the example in Senegal was there was a PMNCH focal person in country who is being serving as a hub for communicating information from global as well as sharing with the country stakeholders, and then organizing civil society to engage in the country platform. And I think when that kind of structure exists, it has been helpful. When that structure is not existing, then it has been on ad hoc basis. And I think this is the same challenge that we encountered throughout the process, and I think this is some of the issues that the countries have highlighted, and again, the engagement strategy need to be able to address some of these issues articulated by the participants. Next slide. So as I said, again, in this meeting we had also invited the investor group members who were in Tanzania ahead of the meeting to come and share their view, their experience, as well as how they see GFF could improve its engagement with civil society. And I've just put on the slide few of the points that was a remark made by the IG members who came to our meeting. Sarah Smith, from Global Affairs Canada, she said that civil societies have a huge contribution. It is clear that there are ongoing challenges and opportunities for CSOs in GFF. We welcome the passion, the zeal that CSOs bring to GFF. It shows that GFF has value and it's worthwhile enterprise where you are willing to engage your own time and expertise. I think it's a recognition of civil society. And then CSO's engagement must be an ongoing process through design and implementation. This has to happen at different levels, regionally and globally. I think Sarah mentioned about, Canada's commitment to ensure this happen at all levels, including the Minister for International Development commitment through Every Woman, Every Child steering group, as well as their country assistance program, where the issue of women and girls is at the center and the role of civil society is quite strongly highlighted. And then in the end, she outlined that, please, count on Canada to support the GFF process and to question the nature of engagement of the country platform. I think that was quite strong and powerful commitment from Canada to hear that, civil society, they see how it's important and the commitment of the government to ensure this is happening through the country platform. Next slide. And again, we also had, participants from the Secretariat, and Miriam was quite very, strong in terms of her view. I think this is a statement that she, I picked from her presentation, that one thing I really do hope is we move from having to make a case that CSOs is important and move towards making CSO engagement more meaningful. Nobody questions the key essential role of civil societies. I think this is very powerful statement and recognition, and it's, I think, it gives us a good platform to position the engagement strategy in terms of the value add as well as the way and the how to make it work. So that is what we are aiming to achieve at the end of the day. Next slide. Again, what's needed to leverage the value of CSO and other stakeholders. Given what civil society has expressed in terms of the challenge they face at the country level, given the commitment that we heard from the investors group, including major investors like Canada, as well as Secretariat, I think we need to seize these opportunities to move forward. And having a representation that reflects the diversity of civil society, selected by civil society, also youth participation. I think we had a youth participant from Tanzania who expressed that there is a need to be inclusive of all stakeholders, including youth. So I think we need to seize this momentum to move forward with the engagement strategy. Again, timely communication at country and global level is quite critical, and I think we need to make that work, and the engagement strategy need to respond to this, and as well as systematic engagement at the country platform on investment case development, implementation, accountability. As you've heard it from Sarah's point, is that it's not a one-off exercise. It has to be meaningful and inclusive throughout the process, from the design, implementation, monitoring and evaluation. So I think we think that this is the right moment, and that was the tone that we heard from the participant, and to moving forward with the civil society engagement strategy. Next slide. So in terms of next step, so the affirmation that we need to develop and finalize the civil society engagement strategy, and the draft was shared with the participant. There was a discussion, and there was quite good input that was received from the countries, and I think those comments will be reflected and an updated strategy will develop. And the key element will include, defining and sharing examples of CSO contribution to RMNCAH. We already have some examples from, Uganda as well as Kenya, where civil society have been able to articulate key issues that have not been picked up through the investment case. I think that has been, we need to articulate that, and role and responsibility of CSOs in the GFF at global, regional, and national level. I think the strategy need to look at, the differentiated role of these different constituent stakeholders at all levels to ensure that actually we have a good engagement supported through stakeholder at all level, and then outlining the role and responsibility for other stakeholders in supporting CSO engagement in the GFF. Once the strategy has been updated, I think we will request feedback from countries as well as other IG members, so that there is a broader ownership and buy-in to move forward. And we presented the outcome of the civil society consultation meeting that was held on 1st November at the IG meeting on the 3rd and 4th. Joanne and I had the opportunity to present the outcome and the key ask, and the investor group welcomed the recommendation by civil society to develop the engagement strategy. They have invited us to present the engagement strategy during the spring IG meeting, which will be in April. So that was a great achievement for us moving forward. So we have work to do between now and November to make sure that we have a strategy that would work for us. Thank you very much. I will stop here. Maybe Joanne, if you have any comment or remark, you are welcome to make. Thank you.
Thanks, Mesfin. And I can just maybe start by just adding briefly on this, and then I don't know, do you want me to then go ahead and discuss some of the outcomes of the IG meeting itself, and then we can open to questions?
Sounds good, Joanne.
Okay. So I would just say, to build on what Mesfin said, the slides that Mesfin just walked you through are actually, with some modifications, essentially the slides we were able to show the investors group as we talked through those issues. And I would agree with Mesfin. I think that there was not only a positive reception, but that people were very strongly, and I would say particularly the folks from GFF countries, the government folks, were really nodding their heads and saying, yes, we need stronger civil society engagement. It's really important to our success. We want to work with you. And I'll come back to a couple of those examples talking through the investors group meeting. And then we agreed, and perhaps we can come back, Kadi or others, with some next steps at the end. But we agreed that we would take the input that came from the civil society meeting and build that into the next round for the civil society engagement strategy, and then look to get even broader civil society input fairly quickly. But then we actually did say to the investors group, as Mesfin said, that we would seek their input, and that may be both by sending out a next draft that has even further civil society input, but it may even make sense to do some one-on-one or smaller discussions with some of the other key stakeholders in the investors group to build support, but actually strategize together. And I would say that one of the issues that did arise in discussions around the investors group meeting was a real awareness that we do need to figure out ways to find streams of funding to support civil society engagement, particularly at the country level. And I think, while there's no sort of final concrete commitments on that right now, there's really awareness by a number of stakeholders and the GFF Secretariat itself how important that is, and that people are actively engaged in looking at that. And we will continue to work with them to ensure that that happens, because we will be essentially, particularly country level, limited unless we can get the resources that we need to do this. Just on one other key civil society issue that was not discussed in the investors group, but where we were able to have some quite good discussions, again, around the margins, because we were there on the country platform guidance. We were able to have some really useful discussions with GFF Secretariat that were, I think, very open, having gotten the feedback about some of the challenges that remain and some of the strategies to improve that. We're very open to some of our input. I think they're being a little wanting to be careful to not be overly prescriptive to countries, but really we're quite open to taking our input based on civil society experience about how to strengthen potentially some of that guidance. So I just wanted to feedback on that. And then I'm not going to go through everything from the investors group meeting, but I'll just flag some highlights. So I would say in the initial kind of updates from Tanzania, since we were there, we heard from the government sort of updates there, and in the country updates, you know, interestingly, the role of civil society organizations came up on a quite regular basis, and you know, and really reflecting the array of things that we had identified collectively, all of us, as roles of civil society. And in Tanzania, for example, they noted the role of civil society right now in the regular process of independent verification of results, or our program results, and that civil society was explicitly engaged in doing that work. And interestingly, it also came up that the health financing strategy will be tabled in the Parliament soon, and just how important it was in general about building awareness of this with new parliamentarians. So several folks raised in that discussion and later the importance of civil society engagement with parliamentarians, so not only around things like the investment case, but particularly around domestic resource mobilization for health and RMNCAH and the health financing strategies. In the country updates, again, I won't go through everything, but I wanted to flag again that the role of civil society came up repeatedly, including particularly, I think, around issues of accountability, but also service delivery, especially for hard-to-reach areas. That was raised, you know, emergency areas in Nigeria, roles in Liberia as well. In Kenya, it was raised the role of, important role of civil society in providing technical assistance, particularly for kind of subnational, because of decentralization in the subnational work and how important that was, you know, and the Vice Minister from Liberia talked about how important, you know, they'd had good conversations with CSOs, but that were really committed to figuring out how they can best be engaged, and they also realized the need for resources to do that, and that included accountability work, but other key areas, I think in terms of service delivery as well, and also potential roles more broadly were brought up around, you know, sort of governance and monitoring of commodities and a number of other areas. In the previous call, I flagged there was an interesting paper on domestic resource mobilization that was not for decision, but was just for information and discussion. But I just want to say two things about it, because I think it was important because of the role that civil society and that we all need to play in supporting domestic resource mobilization. But the paper looked at the impact of increasing, like what were the ways to increase domestic resources for RMNCAH and health more broadly, and looked at the impact of increasing the broader national budget, if you sort of assume then the health budget stayed at the same percentage, and or what would be the impact of increasing the portion of the budget that would go to health. You know, and I think certainly each country is different, but it was clear that to be able to expand the overall pie, the overall national budget was critical. And you know, if the percentage that went to health was maintained, that you would have in many countries even a bigger impact, but that you would also get significant impact by increasing the portion of the budget going to health, even if it wasn't, you know, as high level as reaching, say, the Abuja targets. And then there was also flagged that out-of-pocket expenses overall in these countries now are more than 50%, and while they've fallen as a share of the total health budget, they've actually increased per capita. So obviously a really critical issue. But I would say, you know, again, interestingly, partly what emerged out of all of these discussions, and was not just raised by us but by others, is that this information is really interesting, I think, and quite valuable. But a lot of the implementation of it to either increase the overall budget, and then increase the share of budget to health, certainly can be moved by a number of different partners, including the bank itself, engaging with ministries of finance, but civil society's role is going to be really critical in sort of making any of that theoretical or potential resources actually available. There was also, I'll sort of stick with sort of resource mobilization theme, there was also a GFF resource mobilization strategy that was presented with a sort of set of priorities for 2017 and 2018 for the GFF, and that included supporting governments for increased domestic resource mobilization and public financing for health, and ensuring that RMNCAH receives adequate resources and that both access and equity are addressed. So that was sort of one key piece. And then looking also at how you could have, how you could potentially increase the share of concessional finance, so IDA funding or other kind of innovative ways to increase the pool of concessional finance for RMNCAH as a part of this process. How to broaden the donor base for the GFF trust fund so that there would be more of those core resources that could be used to encourage crowding in other IDA funding, but also increasing the pool of resources for RMNCAH and maybe used in creative ways to also encourage increased domestic resource mobilization. And also if there what are other ways to increase complementary financing, perhaps from other external donors, whether it was directly as part of the trust fund or other creative ways that those resources could be provided and aligned with the country investment cases. And with regards to the trust fund, again, there was a particular focus on both building the donor base, but also the potential of looking at a replenishment moment or a moment perhaps in 2018 where you would be looking at multiple partners making new commitments to the GFF trust fund, though some of that could happen in between, sort of in the interim. So there was, I would say there was sort of, and the other was just looking at opportunities for private sector investment. There was strong support for those priorities and continuing to work together to build on that. And again, among other things, we raised the really key role of civil society to deliver literally on all those things that were listed. And I'll just say something about the discussion on commodities, and then I'll ask Mesvin to say a little bit about, perhaps about the fragile states. So there was a commodities task team that worked to build some recommendations to bring to the investors group, and just overall those were largely, and they were asked for, the investors group was asked sort of to endorse those recommendations, and essentially they did with just a few caveats. And what was recommended was one, that the investors group work with the GFF Secretariat and other partners to strengthen investment case guidelines to ensure a stronger focus on commodity access, because one of the issues that was identified is clearly commodity access is a critical issue, and in many cases it wasn't being addressed as effectively within investment cases as it could with as much specificity. So there's sort of obviously a number of ways to ensure that, but that the GFF investors group would have its eye on that, and working with the Secretariat to ensure that there was stronger guidance on this, and likely looking across the board at sort of how do we improve the technical assistance to support that. And the task team also recommended working the GFF work with the interagency supply group out of the housed at the WHO to address RMNCAH bottlenecks that collaboration with the interagency supply group around those issues would be one critical interface for the GFF, and the GFF investors group supported that. I would say that a number of folks, some were quite familiar, but a number of folks were not as familiar with the interagency supply group, but essentially supported this recommendation to use the interagency supply group as a connection point for GFF, being clear that it wasn't necessarily mandating that it was GFF's role to fund that work, but asking for that, for agreeing to that, and looking to continue to explore that and other ways that the GFF Secretariat and larger partnership could support addressing some of these key commodity issues, again, including ensuring that they were solutions that were better strengthened particularly in the investment cases. Maybe, Mesfin, I'll turn it over to you to just say a few words about the fragile states, because that was another area that was asked for feedback and decision from the investors group.
Thanks, Joanne. Yeah, the fragile states paper was one of the documents presented to the IG for discussion, and this is a follow-up from the previous meeting where the task team put forward a recommendation about the role of GFF in fragile context. And at that stage, the investor group recommended that GFF might not be the best fit for financing RMNCAH in acute humanitarian response, but asked the task team to clarify its role in fragile context as well as, bridging the gap between humanitarian and development nexus. So with that, the task team has worked on in terms of learning from countries that are currently receiving trust fund from GFF. 4 of the 16 are considered as fragile, and then based on their experience, provide a recommendation. So I think the recommendation is basically for the GFF to maintain its current approach, which means that not to expand to humanitarian financing, but rather, helping countries to look at within the existing investment case, looking at fragility, and applying a country-tailored approach, basically to intensify its approach in fragile setting within the country. So that is the key recommendation which the investor group has agreed. And then I think there was a request to consider, other roles of GFF based on availability of funding. I think at the moment there are increased financial resource available for fragile context. I think the next IDA replacement, IDA 18, has actually increased its funding for fragile state. I think that may be one opportunity that may create a new avenue for GFF to look at, expanding its role. And there are also other World Bank related concessional funding for financing refugees, kind of a regional approach. So, this financing are yet, to be materialized, and I think, GFF need to continue to, focus on the existing countries and learning from there, and then based on the learning and based on availability of new financing, GFF could consider its role in the broader RMNCAH in, refugee and other contexts. So at the moment, the recommendation by the IG is only to look at existing countries, sharpen the tool, and learn and document the lesson before expanding to humanitarian context. And recognizing that, the humanitarian system and the funding architecture as well as the players are not necessarily similar to what GFF is currently dealing with. So that was, the recommendation, the agreement that was made going forward, and there will be more work to be done in terms of documenting lessons from existing GFF countries. Thanks very much.
Thank you so much, Mesfin and Joanne, for an extremely comprehensive readout of the CS meeting as well as the IG meeting. In the interest of time, I think we can delve right into any questions we might have received. If we take 10 minutes on that, we can come back to you guys for responses, and then to Aminu and Angela for their perspectives, given they were there as well. Liz, do you have access to the questions that have come in?
Yes, I do. There's just a couple so far, and I'll try to put them up on the screen, and I invite others to ask questions as well.
Do you want to read them out since you have it?
Sure. So we have a question from Paula from Health Partners International. There's a lot of discussion around the role of NGOs and CSOs. Do the same issues apply for small for-profit companies who also work for improved health outcomes? While they belong to the private sector constituency in PMNCH, they do not fall into the category of large private companies which can invest substantially as they operate more like NGOs.
Do you want to read out a second one, and then they can respond to insets of 2 or 3s?
So far, we just have one question.
Okay, good. Mesfin and Joanne?
Yeah, just quickly, Mesfin. I think in terms of the for-profit organization, the way I understand it, that it falls under the private sector constituency, but again, it all at the investment case development stage, where countries prioritize, the services as well as the delivery model. And there has been some, example, I think, specifically from Nigeria, I think that was mentioned, where GFF contracted a private, for-profit healthcare provider to provide health service financed by GFF. So there are examples like that, but very few one. That is the only one I know from Nigeria that was shared to the IG. There may be others. So, but in terms of constituency, the civil society is basically include organizations that are working on accountability, citizen engagement and issues around service delivery, but not necessarily for profit private sector. So that for me it's fall under the private sector, and there is a representation of private sector within the IG as well as country platforms. So I would think that would be the avenue for organizations like that to engage. Thank you.
And thanks, Mesfin. And this is Joanne. I would just add that there is a private, as Mesfin said, I think there is a private sector engagement strategy. So there are opportunities to look at there. And I think it would, it would be smart and important to ensure that that strategy has ways for engagement of small private sector entities as well, and not just larger ones. So that strategy might be something to look to in engagement as with the PMNCH private sector group. I would also say that just the work that we've been trying to do around ensuring that country platforms are inclusive. And I forgot to make this point earlier, but I think we've said it before. It is about engaging civil society, but it's about making sure that all partners can engage appropriately sort of around the table. And we heard even during the investors group meeting that other partners as well in some places were still having challenges with trying to figure out how to fully engage with the country platform in the investment case. So I think the work that we're helping do will and there was acknowledgement of this with the investors group that we want to benefit and fully engage civil society, but also other key constituencies.
Excellent. While we wait for other questions to come in, I wonder if we could ask Aminu and Angela to say a word. Aminu, do you want to go first?
Yeah, thanks so much, Kadi. And thanks so much to Mesfin and Joanne for your credible leadership the last over 1 year in the GFF IG. And I think they have said so much about the meeting of the CSOs, the pre-meeting, and also what has transpired in the IG meeting. So I have 1 or 2 points to buttress to our audience. One, with regard to the CS engagement strategy, over the 2 days that we are in the IG meeting as observers, me and Angela, I have observed and seen the body language of some of the IG members was very supportive of the new CS engagement strategy. A lot of countries, Canada, Tanzania, and also some partners like the BMGF, they were very supportive of supporting the CS strategy at the same time in helping to push it into a discussion and possible support and endorsement by the IG. And also the GFF Secretariat, being led by Miriam, I've also seen a lot of excitement about this effort. So to me, these are opportunities that we should ride on even before the April meeting, where me and Angela are going to sit as the IG members to present this strategy. These are opportunities for the coordinating group to sit down and finalize the strategy and share with the IG and begin to rally and mobilize support across different stakeholders. And also with respect to the country level, as we had from the MESPIN, Cameroon and Senegal are doing well in having more members of the CSOs on the country platform. These are issues that we need to also take forward to ensure that all the GFF countries, they have CSOs representation on the country platform, not only one or two, but at least meaningful engagement. I want to inform the audience now, as a final note, in Nigeria, we are already doing a lot of mobilization. After we came back from Dar es Salaam, the World Bank Country Office organized a 1-hour meeting because the Leslie, who was in Tanzania with us, was in Nigeria on a mission. So we had a very good conversation with her, and also the Health Sector Reform Coalition leading the NGOs in engaging on the GFF. And we have seen a lot of zeal and commitment from the country office to support the Nigeria country platform and to also ensure meaningful engagement. The Ministry of Health GFF focal point in the meeting mentioned that the ministry is already interested in adding 1 member CSO to become 2 members on the country platform. Apart from HAFON, which represent the Health Sector Reform Coalition, they are interested to also allow the CSO to add 1 member, which to me is a positive note. And already the CSOs in Nigeria have agreed to organize a 2-day retreat meeting to deliberate on the representation and who is going to be elected by the CSO group to join HAFON, and also to go through the CSO strategy to provide feedback to the global coordinating group. To me, these are interesting moments that we should keep on pushing. We should keep supporting the NGOs at country level and also providing a regular feedback from the global, regional, down to country level. Thank you very much, Kadi.
Thank you so much, Aminu, for your perspectives on the work at the global regional level and also the experience in Nigeria. Angela, are you online?
Yes, I am. Can you hear me clearly, Kadi?
Yes, perfect.
Great. So I join Aminu in congratulating the outgoing CSO reps to the IG. We are your kids, and we will follow the great footsteps that you've left behind. Hoping to continue to work with you in guiding and enriching the discussions that we expected to again represent at the next 2 years IG meetings. And I also agree with everything that Mesfin and Joanna's presented so far, including the add-ons that Aminu has shared. So I will point out a few things that I think perhaps needs to also come out more strongly. Nothing that has not been said, but one, CSO's importance and role could not be emphasized further to the IG and the GFF Secretariat. And I think going forward, also observing both the body language is that they're getting more excited to hear more forward thinking from the CSOs community. And to this extent, through various deliberations, I think, if I am not mistaken, we highlighted a need to summarize the involvement of CSOs more from the impact that we have had so far since the discussions of GFF started. So we hear many milestones from Kenya, from Nigeria, from Senegal, from Cameroon, but there is need now to synthesize that information so that we continue to make a very strong case on why our involvement as a civil society community is extremely crucial, and what we stand to lose if then we are not on the table. That way, we then don't just discuss and communicate from a very ad hoc case-by-case citations of examples, but we produce a brief that communicates to the inputs and the impact that we've had so far. The other thing that came out from the CSO consultation day on the engagement strategy was that it needs to be brief, a short and very smart document that articulates our forward thinking, looking at priorities and gaps that we ought to occupy at global, regional, and country level. Very specific and high impact loaded strategy that will not only be useful to continuing to communicate to message around the CSO's role, but also that we can use to mobilize resources that we need to continue strengthening our involvement overall at all levels. The third point that I wanted to again add is on the funding for the CSO engagements. It is clear that there is none at the moment that is in existence, and I think as CSOs, the onus is on us to continue doing the good that we've been doing by inputting the agenda of GFF in the forums that we can at various levels, and still asking colleagues who have resources to continue supporting CSO's engagement, especially at the country level, while we mobilize resources and continue to engage the GFF Secretariat and IG to see whether something comes up in the coming months or years. The country GFF forum was also discussed, and as my colleagues have already briefed participants on this call, so far there is no active GFF country forums, and that the call was placed on the GFF Secretariat not to be prescriptive, but rather to help guide countries to ensure that the minimum standards are adhered to, where CSOs representatives are expected to be elected and not appointed by the governments. There was a great participation of youth in this particular CSO brainstorming meeting, and they called out on their specific youth involvement, including requesting the GFF Secretariat to consider appointing or creating a space for a youth representatives to the IG, something that I thought the GFF Secretariat took in interest on and promised an action. The other thing that we overall noted is that we are growing to have very good champions at the IG, Canada being one of them, and surprisingly, ministers of and the high level representatives from Cameroon, Senegal, and Liberia were quite loud on why CSOs matter and why they are very important. The Gates Foundation as well. So I think the conversation for us for this particular forum seems to have landed in the right ears, and I think going forward, working on a very promising engagement strategy is a challenge that we need to take forward and produce a document that communicates what we are aspiring to contribute at various levels. I think I'll stop there because we've been talking a lot to pave way for maybe more questions that we can assist or support Mesfin and Joanne to answer. But I want to take this opportunity also to thank the community for electing Aminu and myself to be your representative. We look forward to your support and insights on how we can do a better job. Thank you.
Thank you so much, Angela. We've come to nearly the end of the call. Liz, have any additional questions come in? We might be able to take one before we discuss next steps and log off.
We did get a number of questions that came in. I could put them up on the screen if speakers want to address just one of them. I'm not sure if that would work.
That would be helpful.
Sure.
Why don't we just jump in? Why don't we just jump in quickly on the commodities issue? Just to say, I want to restate that there was really strong support, I think, particularly for the recommendations on using the investment case to support improved commodity supply in country, and that I think includes, the guidance, but also ensuring good technical support, and strengthening in-country capacity. I think there was strong interest and strong support on that. There was also support for, using the interagency support group as a connector on this. And I think when I say caveats, the only caveats, I think we're really just being clear that it wasn't necessarily a global financing facility's role to be financing the interagency support group. And also I think there was some interest in further exploring and understanding some of the issues around sort of the governance issues there. I think some awareness of that, but wanting to understand that better. So mostly strong support, and just I think those few areas that were more, maybe I would say, clarifications. And I might just say on the paper on domestic resource mobilization, it may be worth just, we can make a commitment to check back with the Secretariat and that whether that paper or some version of that paper could be shared more broadly, because I do think it's a lot of really important background. So if we can note that, then we can follow up on that. And I would just, Mesfin, feel free to jump in, but I feel like there was actually a number of points where nutrition, where it came up in terms of the importance of nutrition. And many of us, I think are also committed to working with CSO networks in country and frankly learning some of the lessons from the folks that have worked on reproductive health and adolescent reproductive health in terms of helping ensure that those have showed up strongly in some investment cases. There have been a few cases where, Kenya and other places where CSO support really helped ensure nutrition was there, but I think there was a lot of acknowledgement that was important but underrepresented. I think there's lessons to learn from colleagues and, a real, I think, commitment among many CSOs to ensure that that's included. So look forward to working with partners. And we did raise the issue of, needing to work more closely with Sun platforms as well as other kind of platforms like CCMs. And that was also, I think, very much acknowledged. So I think implementing that will also be a country-by-country process that it'll take civil society to make sure that happens.
Mesfin?
Sure, yeah, thanks. Just maybe to pick up on the last point on the nutrition. In fact, you'd be pleased to know that, the last 4 countries, especially Guatemala, the trust fund resource that were used to buy down IBRD financing was actually to bring IBRD to concessional rate to support expansion of nutrition services. So it was specifically for nutrition for the Guatemala trust fund allocation. That's one of the reasons why Guatemala joined GFF. So there is quite a lot of momentum going, including nutrition in country investment case. So you will have to look at it case by country, of course, to know what specific nutrition specific activities are financing through GFF. But Guatemala is a classic example. In terms of just maybe the lesson learned, I believe we can share the minutes of the meeting that was held on 1st November. So that's our internal CSO document, so that's free to be shared widely. But there is also a document that was compiled by Susanna Hurd, contracted by Joan, just to do some scoping with interview from countries, GFF focal point, as well as people who have been engaged in terms of their experience. That report is also, I believe, could be shared. So we'll have to look at it, maybe Kadi and Joan can advise, how wide they want to circulate that document. So I think there are quite many lessons learned that can be shared. So that's what I can say. Thank you.
Excellent. That seems to address all of the questions, unless anyone has anything else to add or say. I propose we close the call. We're currently 2 minutes over time. And regroup ahead of the next IG meeting, which will be taking place early next year. No additions? In that case, thank you so much, Mesfin and Joanne, and thank you, Liz, as always, and GHC for helping with these webinars.
Thank you. Bye.
Bye.
Thanks, everyone, and really happy to have actually 4 great new IG member and alternates. So really thrilled with the new team and really committed to continuing to support them.
Thanks. Bye-bye.